Tammy. We're talking about Botox today, and I want you to go ahead and show me what your concerns are and what you're looking to resolve for yourself and your face.
Well, I've got the two lines here, and then I also have little teeny lines that go directly across here.
Raise your eyebrows up. Oh, okay. So are you looking to target these as well?
Yes.
Across the top of your head? Okay. And the brow here as you bring it together, and the eyebrows? Okay. So you want to do this area plus this area?
Correct.
Okay.
All the way across?
So typically, on the average, I would apply 20 units to this area, to the eyebrows, where I add in the procerus and the corrugator muscles go, this complex here in this area, and then I would come to your frontalis, and as you go up, probably about 16 units across the top of your forehead would solve that, so you won't be able to make those expressions anymore. How does that sound?
Sounds great.
Okay, very good. So we start out with some topical, and we'll apply it to her forehead. Allow it to sit on her forehead for about 20 minutes, and then go ahead and apply the Botox in the eyebrow and the forehead. Go ahead and remove some makeup and clean the skin and the site exactly where we're going to apply the topical and then the Botox. And go up again. So you are all the way across. So we're cleaning the skin here, just removing makeup, lotion, oils on the face. Okay, and pretty much right here over the eyebrows. Then we're going to apply the topical. This is benzocaine, lidocaine, and tetracaine. And we go right here. It'll take away the pinch, so it makes application more comfortable. Okay, ice helps as well, so I'll give you an ice pack while we're injecting in case you need that. So let's go like that. So we're going to allow 20 minutes for that to set into the skin, just to take away the pinch. Got plenty on there. Okay, Tammy, I'm going to go ahead and wipe. Just look straight forward for me. I'm just wiping all the topical off because it's slimy and while you're trying to inject. Of course, I get some in your hair. That's always a good day. So we're just going to gently wipe that topical off. You should feel the difference. Okay, ice helps too. Do you want to hold your ice on your forehead just a little bit?
Sure.
Yep, take a minute and just ice your head for a second. You're going to get a quick brain freeze. Okay, you ready? I'm going to start with your eyebrows first. Okay, very first place always starts the middle. Go ahead and squeeze for me. Good. So this right here is your procerus. We're going to go ahead and target your procerus. And we're going to apply 4 units right here in that big, thick muscle right in the dead center. Okay. You doing all right?
Yes.
Okay. Good. Then we're going to go to the corrugators. And go ahead and squeeze again. Right here, this is a typical 11, we call them 11s, where we're going to go ahead and grab that nice thick muscle and go right into that big thick muscle here, which is your corrugator. Okay, good. It's one side. Now we got to go on the other side of the 11. And look how strong she is. Tammy's very strong. So we're going to go ahead and grab them and apply another 4 units here. Good. Very nice. Now we got to go outside the 11s because the corrugators are long muscles, elongated muscles over your eyebrows. So go ahead and squeeze again. We're going a little further out over here. Apply another 4 units to this area. I'm trying to pinch you a little bit so you don't notice the injection as much. Does that make it more comfortable when I squeeze?
Yeah, all I do is feel a little pinch.
Yeah, okay. Good, we're wiping it clean. I always give a little finger pressure. And then our last application for the eyebrow area is going to be over here. Squeeze again. Good. We're going to come out over here above the eyebrow, squeeze, and apply the last 4 units. So this is 20 units in this eyebrow area. Give my little fingers, kind of push it into the skin, and then have you go ahead and ice. So your eyebrows are done. Go ahead and apply your ice again. Okay. Ready? Okay, I'm going to put my fingers back on the veins. Go ahead and lift up for me. Up, 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 up with the eyebrows. Perfect. And relax. I'm applying 2 units at each site, spreading it across the frontalis muscle. You were really strong across your forehead. Okay, and I use my finger. Go up again. Good. Go ahead and ice for me. I change needles for the other sides because it gets dull and it pinches less. So I'll go ahead and remove this forehead. Go up again. Up, 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 up. That's the last one. Okay, very nice. Again, I'm using my fingers to put finger pressure. See how it's slightly elevated? So I'm just going to use my fingers and blend it in under the skin, kind of spread it out over the muscle sheet. She has beautiful skin. Very nice. You can go ahead and apply your makeup if you need to after injection. Apply your ice. Okay. We recommend do not sleep on your face, no strenuous activity or exercise today because it'll make your head very flush. We don't want you to raise your heart rate to increase any bleeding or bruising, and it just will keep you from bruising. If you keep your heart rate down, we also tell you to limit alcohol so it doesn't thin your blood and again doesn't bleed, but you're not going to bruise at all here.
When should I start to see results?
It should take about a week. You'll notice it kicking in just a couple of days, and then at 1 week you'll notice the full effect. Okay, looks very nice. Let's go ahead and apply your ice. So Tammy, what questions do you have about your Botox treatment today?
Just wanted to know when it would start to see results, and you mentioned it could be up to a week. How long do you think it will last?
Every person is actually different. You know, you'll get a good 3 months with your Botox treatment, and then you'll start to see it diminish, and the lines will come back, and then you just reapply again. So some people are every 3 months, some people go as long as every 6 months, and it just depends on your metabolism, the innervation, your facial expressions. So I have people come in minimally, 3, sometimes 4, and sometimes 6.
I think that's great because every time I come get my teeth cleaned, I can get my Botox.
Yeah, I know.
I never knew that a dentist gave Botox until you started doing this.
Yeah, well, it does require formal training. So I took a formal class and got certified to do and apply Botox in my practice. So any dentist can do this as long as they take the required course to know the placement, the usage, the number of units. And I've actually taken a couple of advanced courses as well in Botox placement and fillers. I also do Juvederm. I work around the mouth and around the lips. We can apply Botox around your eyes, certain lines around the face, gummy smiles. There's all sorts of things that you can do with Botox and Juvederm, which has a great application as well in facial aesthetics. So it does require formal training to know how to do that. And a lot of people ask, like, why is a dentist doing this? Well, we inject people all day, every day. And do you want to get, injected by somebody, this is what they do, the masters of the head and neck? Or do you want to get somebody injecting you who passes it off to their nurse in their office? You'll find regular physicians don't give the shots. It's the nurse in the office. So we're very skilled as far as knowledge of the facial muscles at the head, neck, and jaw.
Now,
It's
will this
perfect.
help in preventing future wrinkles?
Yes, because what it is you're retraining your muscles not to make those movements anymore. So a lot of people love that, expression, and so you'll find that because you can't do it anymore, you'll not raise your eyebrows as often because you know you can't. So you're retraining them, and you'll find that the lines. This is good preventative for later on, so that when you hit 60 and 70, you're gonna look way better than the other ones that didn't start sooner. So it's wonderful application to go down kicking and screaming with our age. So, yeah, very nice. I think you'll be very pleased.
I'm excited.
Yeah, it's awesome.